Good day. I am Tavia Alexander, and today I will be looking at pharmacology. I'll be focusing on 5 medication: nitroglycerin, aspirin, oxygen, glucose, and epinephrine. Okay. As an EMT, we should always think about the 6 rights before administering any medication: the right patient, the right medication, the right route, the right dosage, the right time, and the right documentation. We should also contact medical director as well to get their permission, and where possible always take the vitals, because some vitals are contraindication as it relates to giving medication. For the nitroglycerin now, the dosage for the pill is 0.3 to 0.4 milligram, and that is given sublingual, that is under the tongue, right? For the spray, it's 0.4 milligram, and that is 1 spray into the mouth. The reason why you give it, that's indication: persons who are suffering from chest pain as it relates to cardiac problems. Reasons not to give it is hypertension. The hypertension, if the systolic is under 100, we should not give it. So that is why we should take the vitals before. Contraindications: hypertension, head injury, or if your patient has had any erectile dysfunction medication in the past 24 hours, you should not give them. The dosage is by mouth, and the side effects include headache, nausea, vomiting, burning under the tongue. Alright, so I will now move to aspirin. Aspirin is 160 to 325 milligram for the dosage, chewable baby aspirin. It is given by mouth, right? And the indication is for persons who have mild pain or fever, headache, or chest pain with cardiac origin. You could give them chewable aspirin. Reasons not to give them is if they are allergic to it, like hypersensitivity, or if they have had recent bleeding, you should not give them aspirin. The side effects include vomiting and nausea. Oxygen. Oxygen is given to patient with hypoxia, so you will notice cyanosis on the patient, or patients who are not breathing adequately, should give them oxygen. And the dosage is 28% to 100% with the required device. For example, the non-rebreather mask or the nasal cannula. Reasons not to give them, just like the COPD patient, where their hypoxia drive is in place, you want to give them the oxygen because it goes against the hypoxia drive, but at the same time, we should not withhold oxygen from any patient. Side effects include a drop in the respiratory rate for hypoxia, for COPD patient. And glucose. The dosage is half to 1 tube, right? And it is given to patients who have low sugar levels. They're suffering from hypoglycemia, and it is given by mouth. Reasons not to give them: if they have a decreased level of consciousness, or if they're vomiting or are experiencing any nauseous. If they're nauseous, you should not give them. And you should make sure that the patient is conscious so that they're able to swallow, because you don't want to give them and they can't swallow and they choke. Alright? So it is given by mouth, and the side effects include vomiting and nausea. Okay? For the EpiPen, the dosage is for adults is 0.3 milligram, and for children 0.15 milligram. The route is an auto-injector into the muscle, right? Indication, persons who are suffering from anaphylactic reaction, so they are allergic maybe to bees or to peanuts, so they have an allergic reaction, so you give them 1 EpiPen. Reasons not to give them is if they have had chest pain, hypothermia, or hypertension. Side effects include restlessness, anxiety, tachycardia, and hypertension. Right? These are the 5 medications as it relates to their dosage, their indication, contraindication, the route, and side effects. This is my presentation. I am Tavia Alexander. Thank you very much.